So hello there and welcome to Cocoa Pods, a podcast of the Broad Center for Natural Deliveries Foundation. Today we are very, very fortunate to have CDC's Dr. Larry Sperling with us today. My name is Dr. Bola Sagade. I'm the host of this podcast. I'm an OBGYN, a family physician, a women's health specialist, and an advocate for prevention and minimally invasive interventions. I'm going to talk about Dr. Sperling throughout the podcast in bits. So in 2019, September 2019, Dr. Larry Sperling, MD, Fellow American College of Cardiology, became the executive director of the Millions Hearts Initiative. And we will talk about this some more during the podcast. Dr. Sperling is a world-renowned cardiologist and prevention advocate. Dr. Sperling has been a practicing cardiologist for more than 20 years. He has published more than 300 articles and book chapters and has served on numerous regional, national, and international committees charged with addressing cardiovascular diseases. So I want to welcome you to this podcast, Dr. Sperling.
Thank you very much, Dr. Salgade, and it is so wonderful to join you and your listeners today. We want to have this really, really important conversation about extending cardiovascular disease prevention into the community. And I know your husband as well as a cardiologist, so you have done great work, and it is really just an honor today to join on behalf of our Million Hearts team, the Million Hearts Initiative, and our Million Hearts partners across the United States.
Thank you. Thank you. So, every year, about 700 women in the United States die from pregnancy-related problems, and there are identifiable risk factors for pregnancy-related heart problems. Heart and blood vessel conditions such as high blood pressure, coronary heart disease, stroke, and cardiomyopathy, which is the enlarged weak heart. They're leading causes of a woman becoming very sick or dying from pregnancy. High blood pressure happens in 1 in every 12 to 17 pregnancies in the United States. The good news is that most of these problems are preventable, meaning for my listeners out there, you as a woman can take steps before, during, and after pregnancy to help your heart health. And there is help. And this is one of the reasons we have Dr. Sperling on this podcast today. Dr. Sperling, what is the Million Hearts Initiative? Why is there a need for such a movement?
Yeah, thank you for asking. And first of all, just your introduction to our discussion about the importance of prevention. It's really at the heart of the matter. And so you spoke loudly to your listeners about the importance of prevention and awareness, and also raising the awareness that many women during their pregnancy are at risk for heart-related problems. The Million Hearts Initiative is a national initiative. It's a co-led initiative by the Centers for Disease Control and Prevention and the Centers for Medicaid and Medicare Services. It was intentionally developed as this co-led initiative, and we work across all 50 states through several hundred partners. And the Million Hearts Initiative is focused on the very real possibility that we do have proven and effective strategies to prevent 1 million heart attacks, strokes, and cardiovascular events in our nation over a 5-year cycle. The Million Hearts Initiative has launched Million Hearts 2027, and the pillars of Million Hearts 2027 are building healthy communities, optimizing care, and focusing on health equity.
Wow, thank you. Thank you so much. And as we go forward, I want to talk some more about you. As an Emory University cardiologist, you established the university's preventive cardiology program in 1997. Dr. Sperling was awarded the American College of Cardiology Harry B. Graff Career Development Award for Heart Disease Prevention, and the American Heart Association Council on Clinical Cardiology Scholarship for Physical Activity and Public Health in 2001. Dr. Sparling was also the recipient of the 2017 Award of Honor from Emory University's Alumni Association. And now going back to our topics, as summarized by the Centers for Medicare and Medicaid Services, CMS, a lack of access to high-quality maternal health services in rural communities is the result of many factors, including hospital and obstetrics, that is, labor and delivery department closures, workforce shortages, that is, you might just not have anybody doing obstetrics in your area, and access to care challenges arising from the social determinants of health, which have contributed to disparities in maternal health care for rural women and their babies. These access challenges can result in a number of negative outcomes for the mother, including premature birth, low birth weight, the mom actually dying from pregnancy-related issues, the mom becoming very sick during pregnancy, called severe maternal morbidity, and it also causes an increased risk of postpartum depression. These health disparities affect American Indian and Alaska Native and women of color disproportionately. So, Dr. Sparling, what are Million Hearts 2027 strategies to improve access to care for women and people who live in rural areas or other access deserts?
Thanks for asking that question, Dr. Salgado. Rural areas in our country, or what we call access deserts, are one of the priority populations for Million Hearts 2027. And we focus on 5 priority populations with the goal of health equity. I'm originally from New York, but my wife, who's also a physician, is from a very small town in Southwest Georgia. And so we understand the challenges of rural America. She's from a town of about 3,000 people. And during the course of the pandemic, her small town had its hospital closed. And so very much challenges. And Million Hearts 2027 is all about specific, actionable steps to improve cardiovascular health and prevent cardiovascular disease. And some of these related to rural health and access deserts are related to cardiac rehabilitation. We published a paper maybe a year ago or so, and we were the first to describe a concept of cardiac rehabilitation deserts. And you would think these deserts occur in rural areas or, in the middle part of our country, but they're defined as less than one cardiac rehabilitation program for 100,000 individuals in a population. And so larger cities, still urban areas, are often cardiac rehabilitation deserts as well. We've learned a lot during this pandemic about the challenges of delivery of healthcare and also the challenges related to public health. But at the same time, we have recognized some very important opportunities related to telehealth and telemedicine. A really important strategy is utilization of self-measured blood pressure. Those living with high blood pressure, pregnant women living with hypertensive disorders of pregnancy should be able to have a home blood pressure cuff. We recognize that an arm cuff is really of greater precision than a wrist cuff. And this is a really wonderful opportunity for self-efficacy, so owning your risk, being aware of your risk, but it's a really important strategy for partnered care. And so health promotion and disease prevention takes a team. And those living in rural communities, although they may not have access to care as others, we need to think about new care models. For instance, here. And then the Million Hearts Initiative also recognizes the importance of the team. And we support expanding the scope of practice for extended members of the team, like nurse practitioners, physician assistants, pharmacists, and community health workers, to increase access to care to rural populations.
Well, thank you. Thank you for that. So basically, you did talk about, cardiac rehabilitation, the Million Hearts Cardiac Rehabilitation Think Tank. And, basically, what a woman can do in what is called secondary prevention. If you have high blood pressure already and you are pregnant, don't despair. There are things that can be done. You can check your blood pressure at home, and using the blood pressure cuff on your arm is better than using it on your wrist, and you can communicate the numbers to your healthcare provider. So thank you for giving us that. But I want to talk a little bit more about your bio. You did say you are originally from New York, and you received your undergraduate degree from Emory University, where you were accepted into the School of Medicine's Early Acceptance Program as a college sophomore. You graduated with your MD in 1989 and subsequently completed 8 additional years of training at Emory, including a residency in internal medicine, a chief resident year at Emory University Hospital, and an NIH National Institute of Health supported research fellowship in molecular and vascular medicine, and a clinical fellowship in cardiovascular diseases. I say this to encourage the medical students with us so that they know that there can be a light at the end of the tunnel. But going back to the topics at hand, while serving as the Million Hearts Executive Director, you continue to see patients and remain an active member of Emory faculty. We know that maternal health disease has emerged as a major threat to safe motherhood and women's long-term cardiovascular health. In the United States, disease and dysfunction of the heart and vascular system, also known as cardiovascular disease, is now the leading cause of death in pregnant women and women in the postpartum period, accounting for about 4 deaths per 100,000 live births, a rate that is almost twice that of the United Kingdom. The most recent data indicate that cardiovascular diseases constitute about a quarter of U.S. pregnancy-related deaths, that is about 26.5%. What else is being done to address maternal morbidity, that is women dying from pregnancy and pregnancy-related issues?
Yeah, this is a really important question, especially for your listeners and especially for the work that you do. I think we must recognize the risk of many pregnant women in our nation, and that hypertensive disorders of pregnancy are quite common. We also, for the Million Hearts 2027 initiative, have identified hypertensive disorders of pregnancy in African American people as one of our priority areas. And it's a priority area also where we're focusing on the critical importance of health equity. So what can we do about this? One is at the level of the patient, being aware that high blood pressure in the setting of pregnancy can be silent, but can be very dangerous. Coming back to the self-measured blood pressure, there are predictors of risk for hypertensive disorders of pregnancy. And so along with your clinical team, make sure that there's awareness if you are at potential high risk for hypertensive disorders of pregnancy, because coming back to your original introduction, it's at the heart of the matter, right? It's about awareness, but it's also about ownership, empowerment, and focusing on prevention, because many of these events are very preventable. Million Hearts has dedicated some of its work to the partnerships in this space. And we know that the CDC also has made this a high-level priority. There's a campaign called Hear Her. And for the medical students with you today, I often try to provide pearls to our medical students, our residents, our fellows. And one of the pearls I often say is, when in doubt, listen to the patient, right? So Hear Her is all about listening to people, listening to patients, because we can prevent pregnancy-related deaths. This is all about better communication and understanding and listening to the potential warning signs of severe hypertensive disorders of pregnancy. The CDC has also established maternal mortality review committees, and they work with these maternal mortality review committees to improve the review process to inform recommendations for preventing future pregnancy-related deaths. There are also perinatal quality collaboratives, or PQCs, across states and multi-state networks of teams to improve the quality of care for mothers and babies. I want to thank you for the great work you're doing. This is really important and impactful, and wonderful that I get to represent our Million Hearts team and the Million Hearts Initiative and Million Hearts partners.